If you're a guy,
But-
you don't need that estrogen either. You don't want to be asking yourself if you need a bro or a man's ear.
This weird little thing on top of my head.
I don't think it's that bad.
Come on, hair. Whatever. I had no idea an MRI was so loud.
Was it a 60 hertz buzz? Right over
But-
my face.
Right above his head. Right here. Do your breast self-exams. I'm going to say it in every single video. And if you guys are the praying type, that's what we need prayers for. They have plastic surgeons that do that so that you are not all lopsided. Hello everyone, it's Amanda and Bill, and we are back with a breast cancer update. You guys probably saw my initial I have breast cancer video that I made a few days ago, and a lot has happened since that initial video. We have had how many appointments?
3 or 4.
Four.
At least.
4 appointments in 4 days, and we have learned a lot. The overarching thing that we're getting from this is that it's looking promising, so that's good. This last Saturday I had an MRI. That was kind of an interesting experience. I had had a CT scan before, but never an MRI. They let me take Valium before I went in there, so it eased my nerves, so that was good. And they made him stay outside. I really was hoping that you could have been in there with me. I mean, even if not in the MRI room, but just while waiting, because they had me waiting in there in scrubs.
Yeah, I don't know
For a
why they
long
don't let
time.
people into the waiting area of the MRI.
And that's when I have the highest anxiety, is like right before something too. All the anticipation, but occasionally they'd open the door and I could see you. But yeah, I had pretty high anxiety at that point, so I was grateful for the Valium. They had me face down, so that actually made it less claustrophobic, because it's kind of like being at a massage table. Your face is in a face cradle and you can't see anything that's going on. And it's loud, so they put these earbuds in your ears and play whatever kind of music you want. I asked for calming, relaxing music since I was feeling so anxious, and then they put like ear protection over that, and you can still hear it through that. I had no idea an MRI was so loud. Did you know that?
I've never been in an MRI, so no, I didn't.
It's very loud. Yeah.
Was it a 60 hertz buzz?
Oh no.
60 hertz buzz is the standard.
Yeah, it did sound something like that, but very loud. Anyway, I was glad when that was over, and the following day I had a lot of anxiety. So thankfully we had anxiety medication on hand for that kind of thing. I made a video a long time ago talking about my struggle with anxiety. I'll link that here if you want to see that video.
Right over
But-
my face.
Right above his head. Right here. I'm on a regular SSRI anti-anxiety medication, but that hasn't been enough for going through this initial process. Just all of the unknowns has been giving me so much anxiety, and I've been really trying to keep it in check, but every once in a while it would really sneak up on me. So I was grateful to have that medication on hand, and it helped a lot. So yeah, Saturday was the MRI, and we had to wait 2 days to get the results until we went in to meet our surgeon on Monday. We thought he was pretty good. The only thing I didn't like was that he was not familiar with EDS, Ehlers-Danlos syndrome, which is my connective tissue disorder, but after talking to a number of doctors, don't know if that even matters in the grand scheme of things. Protocol is still exactly the same, but he knew what he was talking about, and he was the one that gave us the MRI results. It was looking promising. We actually got to see the image, and it's crazy. It's like a 3D image that they can move around, and you can actually see exactly what the cancer looks like in there. It's kind of crazy, isn't it? I didn't know that you could actually see 3D like that. Amazing that they have that technology. What they could see, at least from visually what they can see with the imaging, there does not appear to be lymph node involvement, and that is huge. That will definitely determine treatment going forward. That was one of the major things that they were looking for, because if there was obvious lymph node involvement, then I would probably have to do chemo before doing surgery, but that was not the case. So that's really good news.
And the surgeon also palpated your lymph nodes.
Yeah.
Didn't feel
Right.
anything.
The surgeon and
And-
both oncologists, and they all agreed that they couldn't feel anything either. They couldn't see or feel anything. So if there are any cancer cells in there, they're just on the inside and they have not grown, or they're just floating around
Well,
random.
there's so few of them in the lymph node that they're not easy to detect.
They're not detectable. So
And the oncologist also said that they look at the tiny little lymph vessels
right, they go.
near the tumor as part
Yeah.
of the biopsy, and they didn't see any cells in those vessels making their way toward the lymph node
Right. So
in the
that's
biopsy, which
very
isn't
promising.
100% because they may just miss them.
Right.
Because they are not taking the whole vessel, they're just taking a little sample.
right.
But
But it's still promising.
yeah,
It's hopeful.
yeah.
So that's really, really good news. They could see the tumor in there, and on this is a black and white image. The normal tissue just kind of looks grayish and black, and the cancer looks bright white. So that was kind of interesting. You could see the tumor in there, which was like the most concentrated white, and then there was the ducts around it, which you could see where the cancer had spread within the ducts. And I didn't realize that it had spread within the ducts quite that far. Thankfully, it's still within the breast. It's not beyond the breast, but there's about a 6 centimeter area that it is still contained within the ducts. So we learned that as well, but it's still contained.
Well, there is one area where it is pushing out of the duct as well.
It's starting to.
Yeah, but it's all still, as far as we know, definitely within your breast.
Right. And that's the most important thing, is that it does not appear to have metastasized, which is what we need prayers for, that it stays that way until we have surgery.
But they said that it has probably been growing for a year,
Yeah, which was surprising
and
to
it
me.
hasn't done that yet. So
Right,
the odds
that
that
it
it
had
will do
only-
that in the next couple weeks or 3 weeks or whatever it is till you get into surgery.
That gives you a sense
isn't real high.
that they think it's been growing. It started about a year ago, which interestingly, I don't know if it's related or not. That is about the time I stopped nursing Teo, was about a year ago.
I can't imagine that that's...
It's probably not related, but
No.
the timing is a strange coincidence. That gives you a sense of how fast or how slowly it grows. I mean, in the grand scheme of things, like if it were to go another year, then it would be bad, but it's still slow enough that, you know, waiting a month to do surgery, it's not gonna grow that much.
But it's fast enough that
But it's
if you
fast
wait till
enough that-
40 to start doing breast self-exams, it wouldn't have worked at all.
Do your breast self-exams. I'm going to say it in every single video. Any and every age, do your breast self-exams. It could save your life. The doctors keep saying it is so good that you found it this early. It really makes all the difference.
Even if you have none of the risk factors.
Yeah, because I have none of the risk factors except for being slightly overweight.
Which is probably a very small risk factor.
and it's a little overweight, and it's not like it's a huge factor. They're
That
much
factor would
bigger.
apply to like more than half of American women.
Exactly. Yeah.
So
But I was pregnant 3 times. I nursed 3 babies. I have no family history.
You're
I
only
don't,
35.
I'm only 35.
You don't
I don't
smoke.
We eat a
you
pretty
don't drink
healthy
any significant amount
diet.
of alcohol.
I mean, I maybe have a beer socially like once every other month kind
You don't
of
even
thing.
use
like,
soy products.
And yeah, that was the other thing, that there really is truth to soy containing estrogen-like compounds in it. And all of the doctors I have seen have said, stop eating soy, because my kind of cancer is estrogen receptive. That makes it worse and can make it grow faster.
So anybody else who has the beginnings of breast cancer that they don't know
yeah,
about,
remove soy from your diet.
well, if they don't know about it, they're going to have to just stop eating soy preemptively.
yes.
It's not a bad
there
idea.
are plenty of reasons to stop eating soy anyway.
If you're a guy,
But-
you don't need that estrogen either.
Yeah.
You don't want to be asking yourself if you need a bro or a man's ear. For you Seinfeld watchers out there.
Leave it up to this one. Carrying on.
Carrying on, yeah, nobody needs that extra estrogen in there.
Yeah.
There's lots of
nobody
other
does. Yeah.
good sources of
Plenty
protein
of
besides soy.
Yeah. And even other legumes.
Even if you're vegan, you can do better than soy.
Yeah.
Seriously.
There are lots of good legume options aside from soy. I mean, that's another risk factor that doesn't apply to me because I'm allergic to soy, and I mean, I still have it in small quantities when it's like soy lecithin that's an ingredient in things, but like I don't have soy sauce, I don't eat soybeans like edamame or tofu. I don't eat tofu like or any sort of soy based products. I just
things
don't.
that use a lot of soy protein in them.
Yeah, because my body doesn't tolerate it anyway with my digestive issues. So maybe that could have been worse.
Yeah, there's a chance it would have grown faster.
Yeah.
I doubt it would have caused the cancer, but once this estrogen sensitive cancer was there, it could have grown faster.
Long story short, do self breast exams because I have virtually none of the risk factors, and yet here I am.
And if you find a lump you're not sure about,
yeah, and it's
be a pest and ensure you get a mammogram.
Get a mammogram. Like, it hurts nothing, and you can find out even if it's nothing. Great, you found out it's nothing. But if you catch it early, like we did, then that can make all the difference in how easy it will be to treat it and your risk factor of death and that kind of thing. Because if you catch it really early, then your prognosis is excellent.
You know, even if it gets to a late stage and you survive, it's going to be a much harder road.
It's going to be a harder road,
to get back
a lot
to being
more
healthy again.
Chemo and infusions and radiation, like it's going to be a lot longer, a lot harder, more suffering. Like, I've talked to a number of people now who have made it through that journey now when they caught it at later stages, and they're thriving now. So it does happen.
More and more.
Yeah.
They're getting better and better all the time.
The cancer treatment is incredible now. But if you catch it early, then you can avoid all that.
That sort of brings us to the results that we got today from the radiation guy and the oncologist who's in charge of the chemo and the
So
hormone
we saw
therapy.
The oncologist today. We saw the radiation oncologist and then the medical oncologist. So the radiation oncologist does the, what's the word I'm looking for?
Radiation therapy?
Localized. They do localized treatment. And whereas the medical oncologists do the systemic treatments.
So the radiation is
So-
just for the site of the tumor, basically.
Right. So they just do radiation directly where it's needed.
They said it was just concentrated x-rays. And it sounds like the side effects of just radiation aren't all that terrible because it is so focused.
Right.
You might
they've
get
really-
hair loss at the site of the radiation.
Right. But
So unless
there's
it's a scalp
none-
tumor, that's
right.
not a problem.
But there's like no other side effects to radiation,
Except
which I
a little
didn't
bit of
know.
fatigue.
You might get like a little bit of skin sunburn type thing
Yeah.
going on, but that goes away quickly. In adults, it has very little long-term effect. I guess it can more.
There's
on
a less
child
than
cancer
1%
patients,
chance
but,
in an adult that it will create an additional cancer later.
right, from
Much higher
radiation
chance
exposure.
in children. I'm not sure what it is, but
Right, just because they're young and growing, but in adults, it's actually a very low risk thing to do. But our radiation oncologist was saying that because things are so contained, and if I get a full mastectomy, then they likely won't even have to do radiation. Unless there's some of the cancer cells in my nodes, they would have to do radiation on my nodes.
or if you have the the BRCA.
Or if I had the BRCA gene. Ironically enough, video that I put up before all of this happened was my 23andMe video. And in that video, I found out that I did not have the BRCA gene. However, they are still doing the more professional blood medical grade test on me to make absolute sure. But considering that came back negative on my 23andMe and I have virtually no family history, it's pretty unlikely that I have that gene.
Yeah.
People that do have it, even if they don't get cancer, they often have you do just a double mastectomy and a full hysterectomy just as a preventative, because you have like upwards of 80% chance of getting breast and ovarian cancer if you have that gene. So it's another thing, if you know you have breast cancer in your family, get genetically tested so you can know, and you can, get those procedures done after you're done having kids before it even becomes a problem. Then you don't even have to worry about it. So we found out that if I have that gene, that would be the only reason I would have to have a double mastectomy. Right. Otherwise, it's either lumpectomy or single mastectomy.
And definitely radiation if it's a lumpectomy, maybe radiation if it's a single mastectomy.
Only if it's involved in my nodes.
Right.
But there is a chance that if I do the mastectomy and there's no involvement in my nodes, this is the most amazing news we found out today from the medical oncologist, is that I might not have to do chemo.
So, yeah, they have a scoring system based on a biopsy of the tumor itself and a genetic analysis of the tumor itself, plus the involvement in the nodes, and I forget if there was one or two other things, and they tell you whether you need chemo or not based on the scoring system.
Right.
And
And
so we don't know where she's going to place on that.
right. So a lot of it, we won't know for sure what the treatment will be until after surgery, because they have to do pathology on the cancer itself once they have removed it.
And they need your genetics results in.
And my genetic, which we will have before surgery. I would be shocked if I had the BRCA gene.
Once again, know if it's in your lymph nodes or not.
Right. Yeah.
But if all
So-
those things are like good, that, you know, it doesn't look like it's the invasive kind of cancer, except for in that one little spot, it's still mostly all contained in your ducts, and the genetic tests all come back good, then
Right, that
she
would
might
be
not-
best case
she might not
scenario.
need chemo
And the
either.
treatment that they would put me on, because I have the estrogen receptors, the cancer cells are 99% estrogen positive, which means that basically this cancer is fueled almost entirely by estrogen. So no matter what we end up doing, I will be doing hormone therapy where they will be giving me estrogen blockers, and that basically just starves the cancer, because that's what it feeds off of, is estrogen.
It's tamoxifen that they would be giving her.
That's the name of the drug.
And it doesn't block estrogen from everything, it blocks it specifically from the tumor cells.
Right. So it's highly specific, which
And
is
so-
amazing. The medical technology is just amazing.
It can have some menopausal-like symptoms, but it isn't really going to create full-on menopause. And if she goes for, 5 years out and there's no signs of any cancer coming back, they might be able to wean you off of it.
But they recommended more likely 10 years.
But so maybe 10
At which
years.
point I will probably be menopausal.
Anyway,
Just
that's
because
like 45.
I know, and that's about when it happens in my family. If it's genetic,
Anyway.
it happens early in my family.
The good
so.
news about that, though, is that it doesn't necessarily cause the kind of bone density loss that
Right.
actual
An
menopause
early
would.
menopause would. Yeah.
There
so,
can still be like hot flashes and stuff, but
yeah. That's manageable. Like, I can manage that.
yeah, hot flashes
And-
are just annoying. Breaking your hip when you're 60 is a bigger problem.
Yeah. That would be best case scenario. And if you guys are the praying type, that's what we need prayers for. Is best case scenario that there is no involvement at all in my lymph nodes, and that they can treat it without chemo and just giving me the estrogen receptors, and that's it. Like
The
surgery
estrogen blockers.
or estrogen blockers. Yeah. Because that's all I would need.
Yeah, that plus surgery.
Surgery and estrogen blockers. And it would be, oh my gosh. That
And
would
changing your SSRI to something
be, right,
else.
because I'm on an anti-anxiety medication, and I guess that can limit the effectiveness of the estrogen blockers, so they would have me switch to another anti-anxiety medication.
SNRI.
Yeah. So that is all very hopeful, and we would very much appreciate prayers that between now and when I have surgery, that none of the cells do travel up into my nodes.
Yeah, I can tell that's what you're worrying about.
I'm worrying about that. Yeah.
I think the odds of that happening
It's
are
slow moving.
low.
It's slow. It's low, but still.
And they even the oncologist said even if there was a tiny bit of cancer present in one or two of the lymph nodes, it still wouldn't necessarily
We still might be able to just
change
treat
your
it
score
with
so much that you had
the
to have
estrogen
chemo.
blockers. And if
Yeah.
I don't have to have chemo, that makes all the difference. I mean, I know it can be done, and I've known people who have done it with kids and everything, and they have their village surround them, and they make it work, and it's amazing. And if we need to do that, that's what we'll do. We will do it. But if we don't have to, then that would make this whole situation so much easier, given that I am a mother of 3 children.
We can only ask the grandparents to come so much.
Yeah, and think we have friends and people that we know who are just surrounding us too and are willing to jump at the drop of a hat too, and they're willing to help us.
But there's also, not wanting to be immunosuppressed in the midst of a coronavirus outbreak. Yeah.
Yeah, that's actually one of the biggest things I fear about chemo is particularly, I mean, it's a
With
little
3
bit...
little kids who are
especially because
germ
we
magnets.
have 3 kids in general, just in your immunocompromised in general, and then this whole coronavirus thing, like, which normally, under normal circumstances, wouldn't scare me too much, just because I think we
For
all
healthy
have...
people, it's probably not that...
like, we have healthy immune
not much
systems. Our
worse than the
kids
flu.
have healthy immune systems. Like, it's pretty unlikely we would die from it. It would be a very mild illness in people like us under normal circumstances.
Probably. It's still a little bit scarier than the flu, but
yeah, but if I'm immunosuppressed, then it's scary.
So that would be
a
good reason
to avoid it. If I don't have to do chemo, it would be amazing. It would be a miracle. So we would very much appreciate prayers that can be the case. Even though we'll make it work if we have to do it, but that would be the best possible outcome. We do have to decide for sure if we want to do a lumpectomy versus a mastectomy, and I am leaning towards mastectomy because if we do the lumpectomy, then they would probably remove like 30% of my breast, and that's quite a bit. And they would have to do radiation also. So I'm thinking I'd rather just get rid of the one and then do reconstruction later, which is what they have plastic surgeons that do that so that you are not all lopsided. Well, I think that's it for the update, and we continue to appreciate your prayers so much. I keep telling Bill that I can feel everyone's prayers. Like, it is like palpable to me, and it just brings me so much peace and hope and comfort. Thank you guys for all the prayers and support. We really do appreciate it, and we will keep you updated as we get any new information. So, which we probably won't have any big updates until I have surgery, which will be in about a month or so. I will be scheduling it tomorrow. So if you guys have any questions, I still don't have comments, so you can send me an email, you can make a comment on the community tab post that I make, or you can go over to Instagram or Facebook because I will link this video in those places also. So that's how you can communicate with me. Thank you guys so much for watching, and we'll see you next time. Bye.
The history of Amazons, they say they cut off one boob so that it wouldn't interfere with drawing their bows.
I won't be putting that in.
Somehow that didn't make it into the Wonder Woman movie, but his prayers smell like fresh baked bread.
I'm not going to be putting that in either.
Anybody who hasn't seen Pastor Gas needs to look him up. I smell fresh baked bread.
It's still recording.